I chose nursing because it's a way for me to give back to my community. And I feel like healthcare in general has given so much to me, and I want to give the same thing back. I was a teacher for 7 years before I started nursing, and I feel like teachers and nurses have to have that same heart of service and care and consideration for others, and nursing has always been the big dream. It's a way for me to bridge science and art. So obviously the science of all the medical stuff we do, right? If we give this medication, here's the expected outcome. That's the science part. And then you have the art part, which is the art of bedside care and patient communication and that family support and getting them the social work support that they may need, or that's the art behind it. And actually, I was talking to a nurse today in clinical about being an advocate and what that looks like. And she was, it was in the NICU, and she was talking to the doctor about her patient had lost the suck reflex, and so she was worried about, when she does eventually go home, is she going to be able to bottle feed? And so she was advocating for her vent to come out, because she was fine. She was able to breathe on her own, just the vent needs to come out, but they were worried about feeding after that. So she was advocating for to get them to order like a pacifier to put in and have like pacifier training before that happens to help her. So a lot of it is just fighting for what the patient needs, because the nurses see everything. The doctors don't necessarily, even family members don't necessarily see the whole picture, but nurses do, and they are the true voice of the patient when they're vulnerable or when they can't speak for themselves or they don't know how to speak for themselves. That's where we come in. Okay, that's why I love Greenville Tech, period. End of discussion. The hands-on training starts from day one. I've had a few other nurse friends that went to other universities around here, and they didn't start, till later on in their training. Greenville Tech starts you right out the gate. You are in lab, you are learning all of these things, and then you go out immediately in the clinical world, practicing those skills hands-on. And I've also discovered that Greenville Tech students are very trusted in the real world because of that. And so we get offered a lot of opportunities to actually do them on real patients. Whether it's, just passing oral meds, or whether it's giving injections, or whether it's a Foley, or whatever it is. When we ask, we usually get to do it. So I'm very happy about that. Coming from an educator background, as a teacher, they are true teachers. They love their students. They're not just here to get a paycheck. They're not just here because they're done with the bedside. They're here to implant great things into these future nurses, and we are able to carry that on, that inspiration, that love, that drive of nursing that they pass it along to us, and it shows. It really does. I could not speak more highly. I've never met a Greenville Tech teacher that wasn't passionate about both nursing and the teaching aspect, and they'll do whatever they need to do to help you succeed. Without the financial support of scholarships and the foundation, it just wouldn't have happened, period. I wouldn't be here. And I feel like every student who gets a scholarship is just so grateful, because we come from all sorts of different backgrounds here at Greenville Tech, and we're so diverse, and that's a part of what makes us so special, is our diversity. And it wouldn't happen without the foundation. You can choose to put your money wherever you want to put it, and I'm so grateful that you chose to put it here, because you truly are making a difference. Those diverse learners that we have here at Greenville Tech, like I said, I wouldn't have been able to do it without these scholarships, and you're literally making dreams come true. That wouldn't have happened without your generous donation.